When I came in, I was about 25 pounds heavier. Numbers were all over the place, but I had a lot going on. And we just kind of calmly talked about different things, the importance of what you eat, how you eat it, not being very active and different. And I kind of took that at heart, and she made some suggestions, and I kind of followed through with them. And then I got excited of wanting to see my numbers change.
So diabetes is really a full body disease. It affects every cell in your body, from your brain down to your feet. It affects cognitive function, vision, your overall cardiovascular health, as well as your nerve health. Complications like neuropathy and even severe things like amputations can result from uncontrolled diabetes. So the physical toll is definitely immense. Emotionally, it's also a very hard disease because there's a lot of monitoring involved with diabetes. Patients have to be very conscious of what they're drinking, what they're eating, how much activity they can do. They have to be aware of the climate outside, because if they're dehydrated, they may have to adjust their medications. How much water they're consuming matters, so they have to routinely prick their fingers to check their blood glucose levels. So it is a very burdensome disease if it's not well controlled.
When I stopped following her routine, and I saw weight loss, and I saw my A1C come down, and kind of got real excited. Not only are there people there that's your age group, but they're patient. They're patient with you. They're super friendly, and very concerned about your health. And that's the goal for us, to live longer, live our fullest.
As you get older, your body has certain limitations, and we want to be realistic. But she is a very excellent example of how, if you listen to your body, take things progressively, you can climb a mountain one step at a time.
Dedicated has helped me a lot. It's warm. It's warm. Nobody is, when you walk into a place, sometimes people as a human, they're short. They don't whatever. I have, in the 8.5 months I've been here, and I came a few times. My husband came first. And I was like, oh, no, buddy, I'm not going there. You going on over there with all them old people. I'm not doing it. And he laughed and laughed. And then I would come to the doctor with him sometime, and I sit out there and I see this. I said, oh, no, that's not me. And he said, okay. He said, and so Beth called me one day, and she said, give it a try. I said, no, Beth, I'm not. So I say, and then I need a female doctor. And she say, if we get one, would you come? I say, if you get one, I might try it. And she called me back and said, I have a female doctor. And what? I said, I'll keep my word. I'll keep my word. And I tried it with Dr. Gohan. And I'm telling you, I looked at that little young chickadee. I said, what's she going to tell me? She was too pretty to be trying to tell us stuff. But she's very knowledgeable and very caring. And so we went through our little spiel of, you got to do this, and you got to do it. And when you say you got to do it, it wasn't like a demand. She's saying, this is my reason for telling you that. And you seem like you really like to go, and you love your grandkids. And so, this will make it be even better. When they run on the beach, you'll be able to run on the beach. I said, okay, sight game, but okay.
What I loved is that she is a 68-year-old female who is just like everybody else. And so that's what I really love about her, is that as soon as, she was really motivated internally to make those changes for herself. And that's why, we chose this field. That's why I became a physician, is you hope that someone somewhere down the line will be willing to listen to what you have to say. And she did, and now she tells me that she feels more energetic than she has in years. She's sleeping better. She's walking 5 miles with her husband in the morning. So she's an inspiration to me as well.
I'll tell anybody to come. I really would. It's for us. It's for us. Now, when I go to have an x-ray or whatever, it's not like I got to go all over the world. I don't have to go, and you don't have to wait. People respect being a senior. They respect that part, and I like that. This is God, because I'm telling you, things have just changed, and they're just getting better.